He was 57 years old, active, no family history of cancer. He felt fine, or at least he thought he did. For months, he had been noticing small changes when he used the bathroom. His stool looked different, sometimes darker than usual, sometimes thinner than it used to be. Once or twice, he thought he saw a faint reddish tint in the toilet water, but it disappeared quickly and he convinced himself it was nothing. Maybe something he ate, maybe hemorrhoids. He didn't bring it up to his wife. He definitely didn't bring it up to his doctor. Men don't talk about what happens in the bathroom. It felt embarrassing, unnecessary, something to just keep to himself. 2 years later, he was sitting in an oncologist's office being told he had stage 4 colon cancer. The tumor had grown through the wall of his colon and spread to his liver. The treatment would be chemotherapy, possibly surgery, possibly radiation. The prognosis was sobering. His 5-year survival rate had dropped from nearly 90% to less than 15%, not because the cancer was unusually aggressive, but simply because it was caught too late. The signs had been there for 2 years. In his toilet, every single day, his body had been screaming at him, and he had looked away. This story is not rare. Colon cancer is the second leading cause of cancer-related death in the United States. Over 150,000 Americans are diagnosed with it every year, and nearly 53,000 die from it annually. The tragedy is that colon cancer is one of the most preventable and most treatable cancers when caught early. The 5-year survival rate for stage 1 colon cancer is over 90%. For stage 4, it drops below 15%. The entire difference between those two numbers, the difference between survival and death, often comes down to one thing: whether a person paid attention to what was happening in their toilet. Today, I'm going to show you the 5 signs of colon cancer that appear in your toilet, explain exactly what each sign means, and tell you precisely when each one demands immediate medical attention. Stay with me until the very end, because I'm also going to tell you about the risk factors that most people don't know about, the screening test that catches cancer before symptoms even appear, and the lifestyle changes that dramatically reduce your risk. This information could save your life or the life of someone you love. Before we get to the 5 signs, I need you to understand one foundational truth. Most people feel completely fine in the early stages of colon cancer. There is no pain. There is no obvious illness. You feel normal. You go about your day, you eat, you sleep, you exercise. Everything seems fine. The only place the cancer announces itself, often for months or years before it causes any noticeable symptoms, is in your toilet. What comes out of your body after a bowel movement carries information about what's happening inside your colon. If you learn to read that information, you can catch cancer early enough to cure it completely. The colon, also called the large intestine, is a 5-foot-long muscular tube that processes waste from your digestive system, absorbs water and electrolytes, and forms and eliminates stool. When a tumor grows in the colon, it can bleed. It can change the shape of the stool as it passes through. It can affect how quickly or slowly the bowel moves, and it can change the appearance and consistency of what ends up in your toilet. These changes are the signs. Learning to recognize them is potentially the most important health knowledge you'll ever have. Let's go through all 5 signs right now. Sign number 1. Blood in your stool or in the toilet water. This is the most well-known warning sign, and it's also the most frequently dismissed. Blood in the stool can appear in 2 ways. Bright red blood means the bleeding is coming from somewhere lower in the digestive tract, like the rectum or the lower portion of the colon. You might see bright red streaks on the surface of the stool, bright red blood in the toilet bowl after a bowel movement, or bright red blood on the toilet paper when you wipe. Dark, tarry, or maroon-colored stool indicates bleeding higher up in the colon or even in the upper digestive tract. When blood mixes with digestive fluids and travels a longer distance through the intestines, it oxidizes and turns dark. Stool that looks like black tar, coffee grounds, or has a distinctive foul smell beyond normal is a serious warning sign that requires immediate evaluation. Here is the critical mistake that kills people. Most people who see blood in the toilet immediately assume it's hemorrhoids. Hemorrhoids are extremely common. They do cause rectal bleeding, and they are not dangerous. So people tell themselves, it must be hemorrhoids. I had those before. It's nothing. They don't see a doctor. They wait. The bleeding continues, sometimes stops for a while, then returns. And all the while, the cancer grows. The truth is this: you cannot tell the difference between hemorrhoid bleeding and colon cancer bleeding by looking at it. They can appear identical. The only way to know is to be evaluated by a doctor. If you see blood in your toilet, in your stool, or on your toilet paper, especially if it happens more than once, you must see a doctor. Period. No exceptions. Hemorrhoids are common. Colon cancer is also common. You need a professional to determine which one you're dealing with. Sign number 2, changes in stool shape, narrow, thin, or pencil-thin stools. Your colon is approximately the diameter of a garden hose at its widest points. When you have a normal bowel movement, stool passes through and forms a shape consistent with the diameter of the colon. But when a tumor is growing on the inner wall of the colon, it narrows the passageway. Stool being forced through a narrowed opening comes out thinner, flatter, or pencil-shaped instead of its normal rounded, cylindrical shape. Most people have no idea that stool shape is medically significant. They assume stool is supposed to vary in shape. And while some variation is normal, consistently thin or narrow stools, especially when this represents a change from your normal, is a warning sign that something is narrowing your colon from the inside. A tumor is the most serious cause, but other conditions like colon polyps and strictures can also cause this. Here's what you should do. Pay attention to what's normal for you. Know what your stool usually looks like. If you notice a persistent change in shape toward consistently thinner stools over several weeks and it doesn't resolve, that is a sign that requires medical evaluation. It's not normal. It's not just diet. It's your colon telling you something is in the way. Sign number 3. Unexplained changes in bowel habits that last more than a few weeks. This sign encompasses a range of changes: diarrhea that doesn't resolve and has no obvious cause like illness or dietary changes; constipation that is new, persistent, and doesn't respond to dietary changes; alternating episodes of diarrhea and constipation; a feeling that your bowel never fully empties after a movement; going more frequently or less frequently than your normal baseline without explanation. When a tumor is growing in the colon, it can disrupt the normal muscular contractions that move stool through the intestine. It can partially block the colon, causing constipation. It can irritate the colon wall, causing diarrhea. It can do both alternately. And the sensation of incomplete emptying, feeling like you still need to go even right after finishing a bowel movement, is a common symptom caused by the tumor's presence, signaling the colon to keep contracting. The key word here is persistent. Everyone has brief episodes of diarrhea or constipation. These are normal responses to illness, stress, dietary changes, or medications. What's not normal is a change in bowel habits that lasts 4 weeks or more, has no obvious explanation, and represents a clear departure from your personal baseline. If this describes what you've been experiencing, it needs to be evaluated. Sign number 4. Visible mucus in your stool in unusual amounts. The colon naturally produces mucus to lubricate the passage of stool and protect its inner lining. A small amount of mucus in stool is completely normal, and you might not even notice it. But when you can clearly see white or yellowish mucus on or mixed into your stool, and especially when this is accompanied by other symptoms on this list, it can indicate inflammation, infection, or cancer in the colon. Colon cancer tumors can stimulate excess mucus production as the colon tries to protect itself from the abnormal tissue. Inflammatory bowel conditions like Crohn's disease and ulcerative colitis also cause excess mucus, and these conditions themselves are associated with increased colon cancer risk. While visible mucus alone is not always alarming, when it's a new finding, it's consistent, and it appears alongside other warning signs like blood or stool changes, it absolutely warrants medical investigation. Sign number 5. Dark, foul-smelling, or unusually greasy stools that float. This sign is perhaps the least talked about but equally important. Stool that is significantly darker than normal without a clear dietary explanation, such as eating large amounts of beets or taking iron supplements, can indicate bleeding higher in the digestive tract. Stools that are consistently foul-smelling beyond normal, oily, or greasy in appearance, or that float persistently on the water rather than sinking, can indicate problems with fat absorption, which can be related to cancers affecting the colon or other digestive organs. While floating stools alone are often benign and related to dietary choices or minor digestive variations, when they represent a persistent change accompanied by other symptoms, they become part of a pattern that demands investigation. The overall principle across all 5 signs is this: any persistent, unexplained change in what appears in your toilet that lasts more than 2 to 4 weeks and represents a departure from your normal baseline should be reported to a doctor without delay. Now let's talk about who is most at risk for colon cancer, because risk determines how urgently you need to act on any of these signs. Age is the most significant risk factor. The risk of colon cancer increases sharply after age 45, and the vast majority of cases occur in people over 50. But colon cancer in younger adults, those under 50, has been rising at an alarming rate over the past 2 decades. No one is completely immune. A family history of colon cancer or colon polyps significantly increases your risk. If a first-degree relative, meaning a parent, sibling, or child, has been diagnosed with colon cancer, your risk is 2 to 3 times higher than average. If multiple first-degree relatives are affected, or if a relative was diagnosed before age 50, your risk is even higher and screening should begin earlier. A personal history of inflammatory bowel disease, either Crohn's disease or ulcerative colitis, substantially increases colon cancer risk, particularly when the disease involves a large portion of the colon and has been present for many years. Chronic inflammation is a known driver of cancerous transformation. Type 2 diabetes, obesity, and physical inactivity are all associated with increased colon cancer risk through mechanisms involving insulin resistance and chronic inflammation. Dietary factors play a major role in colon cancer risk. Diets high in red meat, particularly processed meats like hot dogs, bacon, sausage, and deli meats, are strongly associated with increased colon cancer risk. The World Health Organization classifies processed meats as Group 1 carcinogens, meaning there is sufficient evidence that they cause cancer in humans. Diets low in fiber from whole vegetables, fruits, and legumes are also associated with higher risk. Fiber feeds beneficial gut bacteria, speeds transit time through the colon, reducing the time carcinogens are in contact with colon tissue, and produces short-chain fatty acids that protect colon cells. Alcohol consumption, particularly heavy drinking, increases colon cancer risk. Smoking increases colon cancer risk. Sedentary behavior independent of obesity also increases risk. These are modifiable factors, meaning your choices directly affect your probability of developing this disease. Now let me give you the action plan, what you should do right now based on your age and risk level. If you are 45 years of age or older and have never had a colonoscopy, stop watching this video after it ends and call your doctor to schedule one. The American Cancer Society updated its guidelines in 2018 to lower the recommended starting age for average-risk adults from 50 to 45 specifically because of the rising rates of colon cancer in younger people. A colonoscopy is the gold standard screening test. It allows a gastroenterologist to visually inspect the entire colon, identify any polyps, and remove them immediately during the same procedure. Polyps are the precancerous growths that, if left in place, can eventually turn into cancer over a period of years. Removing them prevents cancer from ever developing. If you have a family history of colon cancer or polyps, screening should begin at age 40 or 10 years before the youngest age at which a first-degree relative was diagnosed, whichever comes first. Talk to your doctor about your family history so they can determine the appropriate screening schedule for your individual risk level. If you experience any of the 5 signs I described in this video, regardless of your age, do not wait for a routine screening appointment. Call your doctor and describe your symptoms specifically. Say you have noticed blood in your stool, or a persistent change in bowel habits, or thin stools. These words will signal to your doctor that this needs prompt evaluation rather than a routine appointment scheduled months away. Now let me give you the lifestyle changes with the strongest evidence for reducing colon cancer risk. First, increase your dietary fiber significantly. Aim for 25 to 35 grams of fiber per day from whole food sources, including vegetables, fruits, legumes like beans and lentils, and whole grains. Studies consistently show that people with the highest fiber intake have the lowest rates of colon cancer. Fiber promotes healthy gut bacteria, reduces inflammation, and speeds transit time through the colon. Second, severely limit processed and red meat consumption. If you eat processed meats like bacon, sausage, hot dogs, and deli meats regularly, eliminating or drastically reducing these foods should be your single most impactful dietary change. Limit red meat to no more than 2 servings per week and choose lean cuts when you do eat it. Replace these foods with fish, particularly fatty fish rich in omega-3 fatty acids, poultry, and plant-based proteins. Third, take aspirin if your doctor recommends it. Multiple large studies have found that regular low-dose aspirin use reduces the risk of colorectal cancer by approximately 20 to 30% and reduces the risk of dying from it. However, aspirin also carries risks including gastrointestinal bleeding, so this decision must be made in consultation with your doctor based on your individual risk-benefit profile. Do not start aspirin therapy without medical guidance. Fourth, maintain a healthy weight and exercise regularly. Obesity is associated with a 30 to 50% higher risk of colon cancer. Regular physical activity reduces risk even independently of weight, likely through mechanisms involving reduced inflammation, improved immune function, and reduced insulin levels. Aim for at least 150 minutes of moderate intensity exercise per week and include resistance training twice per week. Fifth, limit alcohol and quit smoking. Both are independent risk factors for colon cancer with dose-dependent relationships, meaning more consumption equals higher risk. If you drink, limit yourself to no more than 1 drink per day for women and 2 for men. If you smoke, quitting reduces your colon cancer risk along with your risk of virtually every other cancer and cardiovascular disease. Sixth, consider your calcium and vitamin D intake. Several studies suggest that adequate calcium and vitamin D intake are associated with reduced colon cancer risk. Dairy products, fortified foods, and leafy greens provide calcium. Vitamin D is obtained primarily through sun exposure and supplementation for most people over 50 who spend limited time outdoors. Get your vitamin D level tested and optimize it to between 40 and 60 nanograms per milliliter. Let me close with the most important message of this entire video. Colon cancer does not have to kill you. It doesn't. When caught at stage 1, over 90% of people are alive 5 years later. Many are fully cured. The screening tools exist. The warning signs are visible. The risk reduction strategies are proven and accessible. What kills people from colon cancer is almost entirely avoidance. It's embarrassment about discussing bowel habits. It's convincing yourself the blood is just hemorrhoids. It's putting off the colonoscopy for next year, and the year after, and the year after that. Don't be the person who had every opportunity to catch this early and didn't. Look at what your body is showing you. Don't look away. Pay attention to those 5 signs. Share this video with every person over 45 in your life. And make the appointment. Your toilet is trying to save your life. Let it.